This mic is like the perfect height for me. All good. Oh, I thought you were done. My bad.
We're just doing headrooms, but check, because figured you have to. I'm on the taller side, but good.
Yes.
Okay.
Everybody ready? Okay. Good morning. Thanks for joining us for this press conference on measles. My name is Britt Earhart. I'm a public information officer for the County of Santa Clara. This morning, we have spokespeople for you from both the County of Santa Clara and from Alameda County, as those jurisdictions are working together on this response. We'll start off with Dr. Sarah Rudman, who's the Acting Health Officer and Director of the Public Health Department for Santa Clara County, followed by Kavita Trivedi, Dr. Kavita Trivedi, who's the Clinical Guidance Director for Alameda County Public Health. We'll start the presentation with remarks in English, followed by questions in English, then move to remarks in Spanish and questions in Spanish. With that, I'd like to invite Dr. Rudman to the podium.
Thank you. Good morning. Thank you for being here. I'm Dr. Sarah Rudman, Acting Health Officer and Director of the Public Health Department in Santa Clara County. We're here today to make sure the public is aware that the County of Santa Clara received a report of a case of measles. This is our first case in many years, and we want to make sure the public has the information you need to understand your risk and keep yourselves safe and healthy. This case of measles is in an adult who is fortunately recovering well, isolating at home, and did not need to be hospitalized. But during the period this person was potentially contagious, they traveled to several public locations, both here in Santa Clara County and in Alameda County. We want to make sure the public knows that there is a possibility of exposure for people who traveled to 3 specific locations, 2 here in Santa Clara County and 1 in Alameda County, during specific times over the last week. We appreciate the help of the media to get this information out to the public so that they can take a look at these locations and understand if they have been exposed. For individuals who may have been at any of these locations during the time that this person with measles was there, it's important to do the following 3 things. We want everyone who may have been exposed to first find out whether they are immune to measles. Check their own vaccine record, and if they don't have a record, contact their healthcare provider to see if they can figure out whether they are already immune against measles. Second, we want everyone who may have been exposed at these locations and during these times to contact their doctor if they're in a group that may be especially at risk for infection or severe disease. That includes people who may be pregnant, the parent of a young infant and therefore a risk of spreading to an unvaccinated infant, have certain illnesses or medications that weaken their immune system, or are unvaccinated against measles. So anyone in these groups may be at particular risk of getting sick or spreading the illness. We want you to call your doctor. That's individuals who are pregnant, who have a young infant at home, who have illnesses or medications that weaken their immune system, or who are unvaccinated. And finally, we ask everyone who may have been exposed at these locations to monitor themselves for symptoms of measles. We especially want them to pay attention for the period between 7 days after their exposure until 21 days after their exposure. So we want everyone with these potential exposures to measles to watch themselves for symptoms between 1 week to 3 weeks after they were exposed. And next, I'll pass to Dr. Trivedi to talk more about measles symptoms and what we ask people to do in that monitoring period. Thank you.
Thanks, Dr. Rudman. My name again is Kavita Trivedi. I'm the Director for Clinical Guidance at the Alameda County Public Health Department. So I just want to make sure we all understand what the symptoms of measles are. They are usually fever, rash, and then cough, conjunctivitis, which is red eyes, and a runny nose. And again, these symptoms can develop 7 to 21 days after exposure. So what do you do if you have symptoms? If you have symptoms of measles and you are exposed at one of these locations, we want you to be evaluated by your healthcare provider, but we want to make sure that you call them in advance to let them know you're coming. We want to protect other people in the waiting room, other susceptible people in the healthcare facility from not getting measles. So we ask you, if you have symptoms and you're exposed, to call the healthcare facility in advance to let them know you're coming so you can be properly evaluated. So we're very fortunate in the Bay Area to have the benefit of high vaccination rates throughout all of our Bay Area counties. Most people in the area received 2 doses of the MMR vaccine, the measles, mumps, rubella vaccine, when they were children, which offers protection. Young children, unvaccinated adults, pregnant people, and those with weakened immune systems are at greater risk for developing severe complications from measles. I want to emphasize the MMR vaccine is safe and highly effective, and 2 doses of MMR vaccine is the best protection against measles. I also want to just end by saying that if you were exposed at the Starbucks in Newark, on Newark Boulevard, and you are susceptible to measles, so you don't have evidence of immunity, or you're one of those high-risk groups, so pregnant, unvaccinated children, weakened immune systems, we want you to please contact the Alameda County Public Health Department. The number for us is 510-267-3250. Thank you so much for your partnership in trying to identify all the people that may have been exposed to measles.
Thank you, Dr. Trivedi. At this time, we're available for questions in English.
Sorry, your question was whether there was one person exposed. At this time, what we're aware of is a single case, which means a single person who has tested positive and has a confirmed case of measles. The exact number of how many people have been exposed is unknown, and that's why we're getting this important message out to the public right now. While we work very diligently and closely with the individual to understand everywhere they went during the period that they may have been contagious, and we reach out to every single one of these facilities, we recognize that these 3 locations announced today are public facilities, and it's not possible for the owners to know every person who stepped foot in them during that time period. So at this point, we don't know the number of people who may have been exposed to this very contagious disease. And that's why we're asking everyone to take a look at these 3 locations, the specific times when the contagious person was there, and if they understand that they were in that same location at that same time, they are considered exposed. Now, most of our community will have a very high degree of protection and is very unlikely to get sick from that exposure because most of our community has already received 2 MMR vaccines. But for anyone with a weakened immune system, someone in their home who is unvaccinated or who they themselves are unvaccinated, it is those folks who have been exposed and who need to take extra precautions and contact their health officer or their local health department. Right. Measles is a disease that is one of the most contagious diseases we know about. We know that the average person with measles can get up to 14 people sick, and you can imagine 14 times 14 times 14 spreads incredibly quickly if the population is unvaccinated. But here in Santa Clara County and in our neighbors in Alameda, we have a very highly vaccinated population, which is why we expect to be able to contain the spread of this disease if everyone pays attention to their own vaccination status, stays up to date with their vaccinations, and seeks the care we recommend today. Yes. Oh.
Is this a possibility who work in all these locations, or are they limited to these locations?
At this time, we are not revealing any additional information about the person who tested positive for their own privacy. We can simply share that at this point, this person was present in these locations during these short time periods listed here today. Exactly. Thank you. So these businesses, first, we appreciate how incredibly cooperative they've been in helping to protect their patrons and their staff and working with us to understand the constraints of these particular exposures and what it means going forward. But right now, we have no reason to believe there are other measles cases at these locations. And therefore, we have no reason to believe that going to these locations is any greater risk than an average day in our very well vaccinated community. So measles is an airborne disease, which means just sharing the same airspace as somebody who currently has measles and is sick with it can give you measles. Now, the likelihood that that will happen reduces significantly if somebody is fully vaccinated. But an unvaccinated person in the same room with someone with measles, even at the other end of the room, or even stepping into the room after the person with measles has left, has a very high risk of getting sick. That's why we consider this such a contagious disease and why it's so important to be vaccinated and to monitor yourself if you've been exposed.
Has it been since there's, been exposures like this when we're talking about pre-location?
Right. So the last time we had a confirmed case of measles here in Santa Clara County was in 2019. In the interim, we have had the occasional exposure here in Santa Clara County where somebody has passed through here but doesn't live here while sick with measles. And we've worked with our media or with individual private locations to monitor every single exposed person and make sure we know that they are staying healthy. However, that system that helps us know every time there's a measles case, get our arms around it and make sure the community knows what they need to stay healthy, depends on a complicated system of both local resources and federal and state partnerships. And so we rely on that combined network across all three levels of government to make sure we know every time there's a measles exposure and can get that information out to everyone.
Dr. Redmond's provided the information for Santa Clara County. Dr. Trivedi can also provide the information for Alameda County. Thanks, Dr. Trivedi.
Thanks. Yeah, so in Alameda County, we actually did have a case of measles just last year in 2024. This is an individual that had traveled internationally and then came back and developed symptoms. They were fully vaccinated. And they also did go to a location, a public location, and we had to do a very similar notification to the public that this had happened. So we have had experience with this before. It has happened numerous times over the last few years. When people develop measles, they always don't know they have measles at the beginning, so they go and live their lives as they would, and so they're not intending to infect people, obviously. And we really appreciate the partnership of all of these businesses. They have notices up at their locations letting people know, patrons know that this has happened, but we believe there's no risk of anyone going to these locations at this time.
Currently here in Santa Clara County, we have made a point to make sure that everyone here in our county, no matter where they have traveled, no matter where they were born, and no matter their status, knows that they can continue to seek the health care they need from our system and will continue to receive the best health care our safety net system can offer. Right now, we want to make sure that everyone who knows that they may have been exposed at one of these three locations knows that they can contact their doctor, or if they don't have a doctor, can contact either the Santa Clara County Public Health Department or the Alameda Public Health Department to get the help they need. We also continue to work closely with our healthcare system to make sure everyone who's eligible for a vaccine is able to get it, since the measles vaccine is the best way to protect yourself from getting sick when exposures like this happen. Thank you. Oh, sorry.
Are there any other questions in English? So this concludes then the English language portion of the presentation. We'll move now to remarks in Spanish. I'm pleased to introduce Dr. Patty Serrato, Immunization Program Manager for the County of Santa Clara Public Health Department. Patty?
Buenos días. Hoy, en este día, los departamentos de salud pública del condado de Santa Clara y de Alameda están anunciando los lugares de exposición al sarampión y también algunas medidas para protegerse contra el sarampión. En el Departamento de Salud Pública del Condado de Santa Clara se confirmó un caso de sarampión, positivo. Esta persona viajó internacionalmente. Actualmente la persona está aislada en su casa y está colaborando con nosotros. Lo que estamos haciendo actualmente es tratar de encontrar alguna persona que haya sido expuesta y que esté enferma. Y por eso estamos pidiendo el apoyo y la colaboración de la prensa para que hablen y difundan ampliamente la información acerca de los lugares donde pudo haber una exposición al sarampión. Una persona que esté expuesta la consideramos una persona con las siguientes condiciones. Una puede ser, por ejemplo, que haya ido o haya estado en ese lugar, en ese día, en esas horas y que no sepa su estado de inmunización con respecto al sarampión. Si alguna persona haya estado o tiene esas condiciones, lo que les estamos recomendando es que vea su cartilla de vacunación. En su cartilla de vacunación lo que tiene que buscar es la vacuna de la MMR o MMRB. Si no tiene su cartilla de vacunación, usted también puede buscar en el registro de vacunas. Esta es una página electrónica y puede buscar ahí sus récords. Si no los encuentra también puede preguntarle a su médico. Es importante que las personas, principalmente con una inmunidad debilitada o una persona embarazada o una persona con niños pequeños, abajo de 12 meses, que haya estado en esos lugares, que también contacte a su médico. Otra cosa que es importante que queremos recalcar a estas personas que pudieron haber estado expuestas es que busquen por síntomas. Si los síntomas se esperan después de los 7, más o menos de los 7 a los 21 días. Algunos de los síntomas incluyen fiebre, congestión nasal, conjuntivitis o pueden encontrarse sus ojos rojos o también pueden encontrar un sarpullido que ocurre generalmente de los 10 a los 21 días. Otra cosa que nos gustaría mencionar es que en el área de la Bahía tenemos unos porcentajes de vacunación altos. Eso significa que la mayoría de las personas están protegidas. La mayoría de las personas se administran esta vacuna cuando son unos niños. Son 2 dosis, es bien eficaz y es también bien segura. Es importante también mencionar que si alguna persona quiere viajar internacionalmente o a algún lugar donde saben que hay sarampión, que hable con su médico para que le recomiende las vacunas necesarias. En este caso es especialmente importante para los niños menores de 12 meses, que otra vez son los niños que no tienen la vacuna del sarampión. Esa es la información que queríamos compartir y otra vez les agradecemos si pueden compartir estos lugares donde haya exposición, donde pudo haber habido exposición de sarampión para que las personas sepan y puedan protegerse.
At this time we'd invite questions in Spanish.